Hey everybody, it's Dr. Ian Stolman, and I want to talk to you about torticollis. Torticollis is often referred to as wry neck, and it's where a muscle is in spasm, causing the head to be tilted and rotated. We see this a lot in young kids, particularly in the first few months, and it becomes very frustrating for both parents and providers, on top of being really painful and restrictive for the child. This is something that can affect their development. It can affect the way they learn how to move and use their body. It can also affect the shape of their skull, leading to the need for a helmet or a more advanced therapy in the future. Now, most treatments are focused on trying to release the symptom, trying to release the tight muscle. And so therapy or stretches, in some cases Botox injections, and even surgery to cut the muscle in the neck are used as a way of trying to release the tension and help the head return to normal. The problem with those is that they're not addressing the question of why the muscle is in spasm. You see, muscles don't go into spasm on their own. It's the nerves that tell the muscle to go into spasm. In the case of torticollis, the spinal accessory nerve that comes from the brainstem and goes down through the upper part of the neck into that muscle, causing it to tighten or relax. This is where chiropractic comes in, because during the birth process, there's a tremendous amount of pressure of pushing and pulling on the upper part of the neck, and sometimes the top bone in the neck can be torqued or twisted and get stuck. In this case, irritating the spinal accessory nerve, causing that muscle to go into spasm. You see, you can stretch and stretch and stretch that muscle, but if as long as that bone is still irritating the nerve, the muscle's just going to go back into spasm. Hence the frustration on the part of providers and parents. Now, what chiropractors do is, rather than just stretching the muscle, they identify the misalignment in the top part of the neck, and using a very gentle pressure, no twisting, popping, or cracking, restore normal alignment so that the nerves can communicate freely and let the muscles relax and have balance and normal function return. Chiropractic is very gentle, it's very safe, and ultimately it can do an even better job of providing a correction and allowing that to become the new normal for the child, instead of a constant battle to try to release the stretch or release the tight muscle. So that's what we want to do as a chiropractor. And if you are in a situation where your child is struggling with torticollis, or they're not being able to move their head freely, or they've got plagiocephaly, it might be time to get your child checked by a chiropractor. Visit icpaforkids.com and find a pediatric chiropractor near you. Thanks.